Assalamu alaikum. Beta, in this video lecture, I will deliver the lecture on malignant mixed Mullerian tumors. Okay. Beta, let me first tell you that the type 2 endometrial carcinoma. Type 2 endometrial carcinoma, it has three main subtypes. One is the serous carcinoma and another is clear cell carcinoma, and at number 3 is malignant mixed Mullerian tumors. Okay, and out of these three, the serous carcinoma is really important. It's, by the way, the most common of all these three. Serous carcinoma is most common. Okay, and I have delivered a complete lecture on serous carcinoma in the previous video. Okay. Yeah, malignant mixed Mullerian tumor. This is what I am going to deliver here. But a malignant mixed Mullerian tumor, it is also known as carcinosarcoma. And in malignant mixed Mullerian tumor, what does this word mixed means? Mixed refers to, beta, I'll be telling you in kind of detailed explanation, but in general mixed refers to the presence of different components together. Like I'll be telling you, like this tumor contains epithelial component, this tumor also contains stromal tumor, stromal component, glandular component, and some sarcomatous component, that is the mesenchymal component. तो ये ज़्यादा components का mix होना एक ही ट्यूमर के अंदर, this is why we call it mixed Mullerian tumor. Okay, and it is also known as carcinosarcoma. Let me tell you, by definition, malignant mixed Mullerian tumor, MMMT, it is an endometrial adenocarcinoma, जिसका मतलब कि इसके अंदर ग्लैंडुलर कंपोनेंट होता है विथ मैलिग्नेंट मीजनकाइमल कंपोनेंट. इसके पास, अच्छा, पहला कंपोनेंट हो गया एडिनोकार्सिनोमा, यानी कि इसके पास ग्लैंडुलर कंपोनेंट है. दूसरा मीजनकाइमल कंपोनेंट, जिसको सार्कोमेटस कंपोनेंट भी कहते हैं. और इस सार्कोमेटस कंपोनेंट में क्या क्या आ जाता है बेटा? इट मे मिमिक सम एक्स्ट्रा यूट्राइन टिश्यू, जैसे कि स्ट्राइएटेड मसल सेल्स, मायोसाइट्स, cartilage, chondrocytes, adipocytes, and few osteocytes. Okay, so this MMMT contains the glandular component with malignant mesenchymal component, that is also called the sarcomatous components, which this sarcomatous component mimics the extrauterine tissues. Okay, what else? Epithelial component is also present and the stromal component is also present, and this is why we call it mixed tumor. Okay, grossly, how does it appear beta in the uterus, in the endometrium? Let me tell you. Yeah, if we talk about the gross appearance, it is like this. Can you see? This is the nice little endometrium. Coming out is this cervix, and then all the ways down is vagina. This is the cervical os, obviously, and can you see this is very much bulky? This green is the malignant mixed Mullerian tumor. It is very much bulky and polypoid, and it is protruding through the cervical os out. Okay, yeah. और बाय द वे बेटा, ये जो ट्यूमर यहाँ पे मौजूद है, ये मेटास्टासाइज भी कर सकता है, यहाँ से दूर जाता है, लेकिन मेक श्योर एज पर योर टेक्स्ट बुक रॉबिन्स बेसिस, मेटास्टेसिस कंटेंस ओनली एपिथेलियल कंपोनेंट. मैंने बताया इसके अंदर बहुत सारे कंपोनेंट्स मिक्स होते हैं. इसके अंदर सार्कोमेटस कंपोनेंट होता है, स्ट्रोमल कंपोनेंट होता है, ग्लैंडुलर कंपोनेंट होता है, एपिथेलियल कंपोनेंट होता है. जब इसकी मेटास्टेसिस होती है तो मेटास्टेसिस में एपिथेलियल कंपोनेंट होता है. ठीक है, एज पर योर टेक्स्ट बुक, डोंट फॉरगेट इट. एट व्हाट एज यू कैन डेवलप दिस MMMT? Post menopausal women. And if you are suffering from this, if you have developed this condition, obviously you will be presenting with vaginal bleeding. Okay, post menopausal vaginal bleeding, and female must be worried about that, na? If she is post menopausal and having vaginal bleeding, obviously it's not the normal menstruation, so she kind of should be looking like very much worried, and she should go for screening. Okay, if she is suffering from this condition or not. By the way, MMTs are very much worse if they have heterologous mesenchymal component. हेट्रोलोगस मीजनकाइमल कंपोनेंट। अच्छा, मीजनकाइमल कंपोनेंट को सार्कोमेटस कंपोनेंट भी मैंने कहा कि इसको कहते हैं। इसके अंदर अगर बहुत ज़्यादा डिफरेंट हेट्रोलॉगस कंपोनेंट मौजूद हैं, जैसे कि बोनी कंपोनेंट मौजूद है, कार्टिलेजनस कंपोनेंट मौजूद है, स्ट्राइएटेड मसल मौजूद है, तो फिर तो बेटा ये एमएमटी बहुत ही ज़्यादा इसकी प्रोग्नोसिस पुअर होगी और ये वर्स होगा। ठीक है। व्हाट आर द म्यूटेशंस रिस्पॉन्सिबल फॉर द डेवलपमेंट ऑफ दिस कंडीशन? The mutations involved, the mutations involved are same as in case of endometrioid carcinoma. I hope beta you remember endometrioid carcinoma from the part 1 video. It is the type 1 endometrial carcinoma. I have delivered a very detailed and high yield concepts of the type 1 endometrial carcinoma. Go, watch it out. By the way, the mutations which are present in the endometrioid carcinoma same are present in MMMTs. Mutations in the P10 gene, TP53 gene and the PIK3CA gene. Okay, right. And the overall 5-year survival rate in case of this MMMT, that is malignant mixed Mullerian tumor, is about 25 to 30%. That is not really good looking. Okay, I hope you are clear with this, beta. And that's all about beta this lecture on malignant mixed Mullerian tumors. Thank you so much. Class dismissed.